If you watched our last video, you now understand the hidden connection between allergies and autoimmune inflammation like Sjogren's. But understanding the problem is only half the battle. The real question is, what is the solution? Hi, my name is Dr. Carol Wada. I am a board-certified allergy, immunology, lifestyle medicine physician, and a Sjogren's patient. When we think about treating allergies and doing that in the context of Sjogren's disease, we worry about a few things, one of which more antihistamines, which only tend to worsen our dryness. We also could think about a lifetime, or it seems like a lifetime of weekly to monthly shots that take sometimes years to really see their full benefit. And for the autoimmune patient, the old model of allergy treatment is fundamentally broken. So today we are talking about the future of allergy management and why everything you think you know about treating allergies needs to change when you also have an autoimmune condition. So let me start with a reality check. The way we've been treating allergies for decades was designed for people with relatively normal immune systems. But when we have something like Sjogren's disease, we don't have a normal immune system, right? We have an overachieving immune system. So here's what I see happening in kind of the traditional allergy care for autoimmune patients. First, we throw antihistamines at the problem. But many antihistamines have what are called anticholinergic effects. They block the same pathways that help you produce saliva and tears and mucus in your nose. So we're literally making your dryness worse while trying to treat your allergies. Number two, we're offering traditional allergy shots. Those weekly shots have you go into the office. Well, frankly, logistically, they're a pain in the butt or the arm as the case may be. And you already have an overactive immune system that is focusing its efforts on essentially attacking your own tissues. So on top of that, we're asking you to commit to 3 to 5 years of weekly to monthly injections, hoping that your immune system will learn to calm down. Now, we do know that these can be helpful, but sometimes those shot appointments can lead to a minor flare-up. And so if you're having those minor flare-ups week after week, month after month, it can make it challenging to actually get to that therapeutic dose that we need in order to affect that immune system retraining process. Third, when patients don't respond well to conventional treatment, we tend to just add things on. More antihistamines, nose sprays, eye drops, maybe some steroids. We're building a house of cards, and each medication we're trying to counteract the side effects of the last one. And the result is you're taking more pills, you're spending more money, you're dealing with more nasal irritation and nosebleeds. It's a system problem that isn't your fault, right? In the end, you're doing all these things and you still often feel pretty terrible. We've been using 20th century solutions for a 21st century autoimmune complexity. So the future of allergy management isn't just about suppressing symptoms, it's about re-educating your immune system at the cellular level. Think about this scientifically. Your immune system is like a computer that's been programmed with faulty code. Traditional allergy treatment is like constantly hitting the pause button when the computer starts acting up. But what instead of pausing the program, we could actually rewrite the code? And that's exactly what precision immunomodulation does. Instead of just blocking histamine release or suppressing inflammation, we're teaching your immune system to recognize allergens as harmless. And we're creating what immunologists call immune tolerance. And here is the fascinating part. When this works correctly, you don't get relief just from your allergy symptoms. Often we see a reduction in the overall inflammatory burden. It means better energy, fewer flares, improved sleep, and a general sense that your body isn't constantly fighting against itself. What also makes this approach different from anything else you've tried before is it's not about taking something every day forever. It's not just a Band-Aid. It's about strategic intervention that creates lasting change in how your immune system responds to your environment. This is precision medicine at its finest. We're not just treating allergies, we're optimizing your immune system's response patterns for the long-term health. So What should the ideal allergy treatment look like for someone with an autoimmune condition? I believe there are 3 non-negotiable criteria. The first is efficiency. We don't have time for treatments that take years to work or require us to restructure how we live our entire life around medical appointments. We have enough of those already, and we're running on low energy, borrowed spoons. The ideal treatment should deliver meaningful results in weeks to months rather than years. Think about traditional allergy shots, weekly visits for 6 months just to reach your maintenance dose, at which point we hope that we're going to have some improvement. Then we work out towards monthly shots, right, for 3 to 5 years. And that's potentially 200 plus medical appointments for one course of treatment. For someone that is managing an autoimmune condition, that's not just inconvenient, it's frankly unsustainable. The second we need, non-negotiable, is precision. The treatment should be tailored specifically to your immune system's needs and to your specific allergy profile. No more one-size-fits-all approaches or generic protocols. This means comprehensive testing. It means understanding not just what you're allergic to, but how your specific autoimmune condition affects your allergic response. It means dosing and delivery methods that account for your hyperactive immune system. The third is measurable reduction in the total inflammatory load. This is a big one. The treatment shouldn't just be reducing your sneezing. It should measurably decrease the inflammatory burden on your entire system. In a perfect world, we would be able to track biomarkers to show that your immune system is becoming less reactive overall. But what we know about folks with Sjogrens and other autoimmune conditions is that sometimes, even on our worst day, those biomarkers that we tend to use, like our CRP and our ESR, sometimes those are normal to begin with. So often what I use is a multi-system review of systems to really get an idea of where you're having inflammatory symptoms and tracking that over time. How's your energy level? How's your sleep quality? How's your overall sense of well-being? How is your joint stiffness? All of these are really important markers when we think of that total body inflammation. When these 3 criteria are met, you're not just managing allergies, you're optimizing your immune system for better long-term health outcomes. So here's what's really exciting, that technology to meet all 3 of these criteria already exists. And we're not talking about experimental treatments or therapies that might be available in 10 years, though there are some really good medications and clinical trials that you've heard me geeking out about on prior episodes, and we'll link to those too. When we're talking about precision immunomodulation techniques, they're being used right now to treat allergic inflammation. But first, let me address the elephant in the room. And this comes up in every conversation I have with a patient that has both allergies and autoimmune disease like Sjogren's. And I know what you're thinking, Dr. Wada, if I already have an overactive immune system, won't allergy immunotherapy make it worse? The evidence actually shows the opposite. There's a landmark trial looked at 20 years of observational data that found that allergen immunotherapy does not increase the risk of developing new autoimmune diseases. And in fact, patients who received immunotherapy had lower rates of autoimmune conditions than the general population. We also have studies that show, people who get this treatment early in life before they have children, their kids are actually at a lower risk of developing allergies. We know that immunotherapy really helps reprogram the system, kind of recode the system, like we mentioned. We know in kids who receive immunotherapy, they're less likely to go on to develop asthma and other inflammatory conditions. So it really does move the dial when we're thinking about, treatments that are really focusing in on those root causes and really changing the dynamic and the trajectory of where the immune system is headed. Large surveys of practicing allergists also report that serious problems like autoimmune disease activation occur in less than 1.5% of patients that they're treating that have autoimmune disorders. That's remarkably low. When we look at guidelines that exist from, the academies of allergy and otolaryngology. These guidelines specifically support the safety of allergen immunotherapy in this context. And here's why this works. The immune system mechanisms that promote immune tolerance rather than autoimmunity. So we're inducing the formation of regulatory T cells and B cells, increasing protective antibodies and suppressing those inflammatory T cells that tend to cause the problems. These mechanisms could theoretically be beneficial for autoimmune patients, but that specific treatment of trying to use this technique to treat autoimmunity has not quite been explored yet. So now I'm talking about approaches that can deliver what used to take years of treatment in just a few strategic interventions. Methods that bypass the traditional barriers that make conventional allergy treatment so problematic for those of us running on less energy and less time and wanting to just be more effective and efficient with our resources. For example, there are now delivery systems that can direct therapeutic agents like these little solutions of pollen, dust mites, our beloved pets, precisely to the immune cells that need reprogramming without triggering the inflammatory cascades that often cause problems for autoimmune patients. There are protocols that can achieve immune tolerance in a matter of weeks with adherence rates, meaning people are actually able to show up to each of those treatments approaching 100% because the treatment is so efficient that patients actually complete it. And there are monitoring systems that we can use to track your immune system's response over time, allowing for precise adjustments to optimize outcomes while minimizing any risks of triggering autoimmune flares. But here's the thing, and this is crucial, these advances aren't being offered everywhere. Many allergists are still using the same protocols we learned in training decades ago, and many physicians aren't even aware these options exist. But they do, and they have for close to 30 years, just primarily in places like Switzerland and the University of Zurich, where these techniques were really pioneered and continue to be studied. This unfortunately creates a two-tiered system. Patients who know about these advances and can access them, and patients who are unfortunately kind of stuck in this outdated approach that weren't really designed for their complex needs. You might be wondering if these treatments are so much better, why isn't everyone using them? And the answer is complex, but it comes down to a few key factors. The first is medical education moves really slow. If you've seen the movie Zootopia and there's that scene with the sloth, that is the speed to which medical education proceeds. I was super fortunate in that as I was transitioning from residency to fellowship around 2014, Dr. Thomas Kundig, one of the really leads in this research, came over from the University of Zurich and gave a talk on this treatment. And I had been fascinated ever since. And that is really what pushed me to learn, to get trained, and to understand the science behind this technique. But most physicians, including myself, are trained in established protocols that may not be familiar with cutting-edge developments in immunomodulation. And frankly, medical education tends to be slow, in part because they don't want to overshoot or teach the wrong things or be too aggressive about teaching new things. It's a more conservative environment in that regard. Second, these approaches require specialized training and equipment. Not every allergy practice has an ultrasound and is equipped to deliver precision immunomodulation therapies. That's why I partnered with the ONI Learning Network to train with the best of the best, the known leader in intralymphatic immunotherapy in North America, frankly. She is the US ambassador for ILIT. And to partner with this incredible team of physicians and other clinicians who are really focused on bringing the best and the most precise treatment to their patients. And third, honestly, there is an economic factor. The traditional model of long-term treatment with multiple office visits is financially predictable for medical practices. And frankly, it's been what's covered by insurance. So if you have a practice that functions within the insurance-based programs, this is what kept the lights on at many allergy practices for decades. The reality is, though, that treatments that work quickly and efficiently don't always fit this traditional revenue model and frankly kind of scare allergists because it's not something they're familiar with. But for you as a patient, especially as someone who's managing an autoimmune condition, settling for outdated approaches isn't just inconvenient, it also has potential harm. Every day you spend managing symptoms instead of addressing that perfect storm of root causes is another day that your immune system remains in that inflammatory state. And the good news is that forward-thinking physicians are beginning to adopt these approaches. The challenge is finding them and understanding how to access these treatments. So here's where I need to be completely transparent with you. And that is something I've promised you from, the beginning of all of this social media stuff, right? What I've described today, the future of precision immunomodulation for autoimmune patients, isn't theoretical. There is a specific protocol that embodies everything we've discussed: efficiency, precision, measurable reduction in inflammatory load. I'm not going to reveal the full details yet in this video, but here's why. This information is too important and too specific to be shared in a general YouTube video that anyone can stumble across. The protocol I'm referring to requires proper context, detailed explanation that's going to be a little longer than the typical, 15-minute visit here or 15-minute little talk here, and the ability to answer your specific questions. It requires understanding your individual situation, and that's how this approach might fit into your overall autoimmune management strategy. This is exactly why I'm hosting the virtual Sjogrens Summit, July 17th through the 19th. There will be an exclusive session dedicated entirely to this groundbreaking approach to allergy management for autoimmune patients. In that session, I'll share the specific name, mechanism of this protocol, interlymphatic immunotherapy, a little bit more, real patient case studies and outcomes, how to determine if you're a candidate for this approach, how to find physicians who offer this treatment, what the treatment process actually looks like, expected timelines and success rates. This isn't information you'll find anywhere else. I've deliberately kept most of the important details for the summit, with a few little, breadcrumbs along the way, because I want to make sure that you get the complete picture, not just fragments that might be misunderstood. Live access to the summit is completely free. You can register at the link in the description below. But understand this, the exclusive allergy management session will only be available to those who are registered. So you're going to put in your name and your email, you'll click that you're interested in that session, and that then lets us know how big of a Zoom room we're going to need, because seats will be limited based on that. If you are serious about moving beyond the outdated model of allergy management, if you're ready to explore precision immunomodulation that's designed specifically for autoimmune patients, this summit is a non-negotiable. Don't let any other allergy season go by just managing symptoms with Band-Aids that weren't designed specifically for you. The future of allergy management is here, but you have to take that initial step to access it. Register now. I'll see you at the summit, and this information could really fundamentally change how you manage both your allergies and your autoimmune condition. Thanks for watching. Stay tuned for our next episode. And get registered for the summit. What are you waiting for? Invite a friend too. The more the merrier. Take care.